term. The importance and benefits of physical activity can improve health and reduce the risk of developing several diseases such as type 2 diabetes, cancer, and cardiovascular disease. Some of the benefits you will receive from physical activity would be immediate, while others may be long-term. A minimum of 30 minutes a day can improve the overall quality of life. It has also been proven that exercise helps with depression better than any prescribed medication. Physical activity can also raise self-confidence as you notice results appearing before your eyes. The minimum physical activity recommendations for substantial health benefits for an adult is approximately 150 minutes of moderate exercise per week. If exercising at an intense level, only 75 minutes is needed. Each bout of exercise should be done in at least 10-minute increments. For more extensive health benefits, adults should exercise for 300 minutes per week at a moderate intensity or 150 minutes of intense exercise. These two training types can be paired together throughout the week to vary your training. Adults who do muscle strengthening exercises such as lifting weights or calisthenics that involve all major muscle groups at least 2 days a week have added health benefits. The minimum physical activity level for substantial health benefits for a child is at least 60 minutes per day and at least 3 days of vigorous activity during the week. Children should also do muscle strengthening exercises and bone strengthening exercises 3 days per week during their daily 60 minutes.
The FIT principle is a way to monitor an exercise program. The acronym FIT stands for frequency, intensity, time, and type. Frequency consists of how often one exercises. For example, aerobic exercise 3 days a week and resistance 2 days a week. Intensity tells how hard one exercises. This can range from low, moderate, or high intensity. It is recommended that healthy adults participate in moderate to vigorous intensities, while those who are severely deconditioned should stick between light to moderate. Time is a measure of how long one exercises. It is suggested that 30 to 60 minutes of moderate intensity and 20 to 60 minutes of vigorous intensity are completed. This, however, can also be broken down into at least 10-minute sessions and still produce the same results. Type is what kind of exercises is to be completed. Aerobic, rhythmic exercises uses large muscle groups and is recommended for everyone due to minimal skills required. Resistance, that includes all major muscle groups, consists of multi-joint exercises that can be completed by many as well as single joint if desired.
absorb and use the oxygen during exercise. One way to assess cardiorespiratory fitness is to perform the submaximal bike test. Muscle strength is the muscle's capacity to use force when there is resistance. You can determine muscle strength by bench pressing. Muscle endurance is the ability to perform a specific muscular action for a long period of time. A way you can determine muscular endurance is superset curls. Flexibility is the range of motion of the joints or the ability of the joints to move freely. You can determine flexibility by performing a sit-and-reach assessment. Body composition is the proportion of body fat and fat-free mass in the body. You can assess body composition by using a skin fold caliper. A healthy body composition is a lower percentage and a higher fat-free mass percentage.
There are many different paths that you can take by pursuing the study of exercise physiology that play into the larger role of sports medicine. There's athletic training, physical therapy, nutrition, biomechanics, and an MD. Some of these careers only require a bachelor's degree. However, for the more professional paths, such as PT or an MD, they require graduate and med school work. What is exercise physiology? Exercise physiology is the study of bodily function during and in response to chronic exercise. Exercise physiologists create exercise prescriptions to improve the physical fitness of a client or patient. They can work also as a personal trainer, strength and conditioning coach, physical therapist, occupational therapist, physician's assistant. Exercise physiologists can also become board certified by the ASEP, but it is not required to practice. What is athletic training? Athletic trainers are trained professionals who work with physicians to provide emergency care, prehab, clinical diagnosis, and rehab services. They can offer medical services to athletes and the general population. ATs are known to specialize in prevention and rehab while educating their patients. They can work in schools, universities, hospitals, and the military. Unlike exercise physiologists, 48 out of 50 states require ATs to be board certified. What is kinesiology? Kinesiology is the study of bodily movement in humans and non-humans. Their job tasks include injury prevention, managing chronic disease, and assisting individuals in reaching their peak performance. Kinesiologists are the human movement professionals. They use research to make programs for people to reduce time lost due to injuries and accidents so that they can get back to work faster. Kinesiologists can register to take the test to become registered kinesiotherapist. Exercise physiologist specializes in developing an exercising routine for an individual, while athletic trainers and kinesiology focus on prehab, rehab, and injury prevention along with proper body movement. Exercise physiology can be a stepping stone to other desired career paths. If you wanted to be a strength and conditioning coach, it would be a good resume builder to earn your CSCS from NSCA. If you're interested in a clinical path, then graduate school would be necessary to further your degree. Whatever your decision, exercise physiology opens the door for your success.